Hello, my name is Amanda Pellegra, and I am one of the hospital medicine nurse practitioners. In my position, we help medically manage many of the orthopedic patients before and after undergoing surgery. As part of my D&P scholarly project, I worked with orthopedics and anesthesia and pain medicine to create a neuromuscular complex hip surgery pathway. Introduction. Pediatric patients with multiple chronic medical needs undergoing complex hip surgery require many interventions to ensure optimal health outcomes. Undesirable consequences of surgery include pain and prolonged hospitalizations. Implementation of a surgical pathway, including the most effective interventions based upon evidence-based practice, has been shown to improve pain and length of stay without compromising health outcomes in adults undergoing surgical procedures. However, using such mechanisms in pediatric patients with multiple chronic medical needs was sparse. Therefore, the purpose of the project was to develop a surgical pathway in pediatric patients with multiple chronic medical needs and investigate the effects as guided by the synergy model for patient care. Figure 1 is an example of the neuromuscular hip pathway, which can also be found under clinical pathways on KidsNet. Implementation. A multidisciplinary team to include orthopedics, anesthesia and pain medicine, and hospital medicine met regularly to create the pathway, based upon the literature and expert recommendations. The pathway was agreed upon by the multidisciplinary team and integrated with an EPIC. Education was provided to the nursing units, orthopedics, anesthesia and pain medicine, and hospital medicine. The pathway went live in September 2020 after experiencing delays from the COVID-19 pandemic. Design. The project was a quality improvement initiative in which a surgical pathway was created and implemented with pre- and post-implementation comparison through chart review. The participants included in the project were males and females between 1 and 26 years of age who underwent a complex hip surgery with specific current procedural terminology, CPT codes, and history of neurogenic hip dysplasia secondary to cerebral palsy. Table 1 describes the sample characteristics of 7 males and 5 females in the pre-intervention group and 2 males and 2 females in the post-intervention group. A retrospective chart review was completed to compare the length of stay, pain scores, and complication rate for 5 months before implementation and for 5 months after implementation. Complications were defined as an unexpected transfer to the PICU within the post-op hospitalization period, a surgical site infection within 30 days of surgery, unexpected return to the OR within 30 days of surgery, or an unexpected readmission within 30 days of surgery. Results. Independent samples t-tests were used to evaluate the outcomes data as demonstrated in Table 2. Results demonstrated an improvement in the average pain score by 0.51 on a scale of 0 to 10 from pre-implementation to post-implementation, and an increase in the length of stay by 0.08 days from pre-implementation to post-implementation, though changes were not statistically significant. The rate of complications was also not statistically significant between the groups, though it decreased from 33% in the pre-implementation group to 25% in the post-implementation group. Conclusion. The neuromuscular hip surgical pathway was successfully implemented. Results of this specific study demonstrated minimal improvement in pain scores and a negligible increase in the length of stay post-implementation with slight improvement in complications. However, there was a small sample size and changes in measures were not statistically significant. Future studies are needed to further investigate the impact of the hip surgical pathway for pediatric patients. Thank you for listening, and please email me with any questions.